Hi, everybody. My name is Tiffany Kildale. Welcome to the first webinar of the Step into Podiatry webinar series. I am the Career Development Manager at the American Podiatric Medical Association. Thank you all so much for registering and taking the time to join us today. We're super excited to have you all with us. We hope to host a couple of similar webinars like this. Morning, Mandy. I just saw your question come through. Thanks for that. We hope to host a couple of similar webinars like this in the coming weeks to help address any questions you all may have about a career in podiatry and applying to podiatric medical school. This webinar is being recorded and we'll make it available on the Step into Podiatry website later. We'll make time for audience questions throughout the broadcast. So if you have any questions, you can submit them by typing them directly into the question box on your GoToWebinar control panel. I'm the one that receives them, so I'll be reading them as they come in. I'll share them with our guests. Today, we are excited to have Dr. Diane Tower, Director of Clinical Affairs at APMA. She's joining us today, as well as fourth-year podiatric medical student, Sriya Babu. I'll hand this over to Diane. Dr. Tower.
Thanks so much, Tiffany, and good afternoon, everyone. Thank you for joining us today. We'll start with an introduction of our guest, Sriya Babu, and then jump right into questions. So welcome, Sriya. Sriya went to undergrad at the University of Pittsburgh, where she studied biological sciences and dance. She's a current fourth-year podiatry student at Barry University in Miami, Florida, and will be graduating next month. She'll be heading to Long Island Jewish Forest Hills at Northwell Health in New York this summer for her 3-year residency training in foot and ankle surgery. Sriya, thank you so much for spending time with us today.
Thank you for having me, and thank you everyone who's listening in on this. I'm about to graduate next month, and it feels like the perfect time to give back to the profession by telling you all a little bit more about it.
Wonderful. Thanks, Sriya. We'll get started right in with the questions. So Sriya, the first question I have for you is, what led you to choosing podiatry as a profession?
Ever since I could remember, I wanted to be a doctor. At the same time, I grew up with a passion for dance and the creative arts. So I always knew I wanted to be a doctor in a field that entailed a lot of creativity and activity. It wasn't until I was working in a lab my junior year of college, when my mentor told me I was very good with my hands. And that actually first led me to looking into dentistry. I then later stumbled into podiatry, and I was completely enamored by the profession. The podiatrist I shadowed had a very active schedule, moving from the hospital to her private practice to wound care clinic, and I noticed that the profession was very hands-on, creative, and there was a direct impact being made on a daily basis.
That's great. Thank you, Sriya. Now, you mentioned in your response the hands-on nature and the creativity. Were there other factors that led you to choose podiatry over other medical professions like dentistry that you also mentioned?
Sorry, you got cut up a little bit over there. I just heard, was there other professions that I looked into?
Were there other factors other than being creative or hands-on that led you to podiatry over things like dentistry?
Things that led me to podiatry was that although it was like a specialty in itself, it was also very all-encompassing, interdisciplinary. I was able to work with many other physicians in the hospital. For example, podiatrist works with the endocrinologist, internal medicine, etc.
So the ability to collaborate with other specialties sounds like that's something that you enjoy. Are there other favorite parts of the profession that you'd like to share with our listeners today?
I think one of my favorite parts of the profession, which is very unique, is wound care. Podiatrists are specifically trained in dealing with wound care, and with diabetes being one of the forefront pathologies that we see here in America especially. It's very unique to our profession that we get to treat something very specific to diabetes.
Now, Sriya, once you made your decision to apply to podiatry school or podiatric medical school, What was that process like for you?
I think it arose in a very almost delayed fashion. I didn't really make my final decision to applying to podiatry school until around my senior year of college. And to the traditional pre-med applicant, this may seem pretty late, but the great part about all of this is that all the prerequisites, including taking the MCAT, is the same as allopathic and osteopathic medical school. So it makes the process a lot more easier. You don't have to start college immediately saying, I want to go to podiatry school. You can take your time with it and definitely choose later on.
Great. And in your application process, there are 9 colleges of podiatric medicine in the US. How did you decide which schools you wanted to apply to?
So I actually applied to all of 9 schools. The application process makes it fairly easy where it's a one-time application that you can choose which schools to send your application to. So in my head, I thought, why not just send it to all? I am from the East Coast, so I definitely did want to stay closer to my family. I went to Barry University. I think that when choosing podiatry schools, every factor is unique to every person. It's a very personal choice. There are only 9 schools at the end of the day, so that does make the decision easier.
Great. Now that you are in and almost done with your 4th year, what's it like being in podiatry school?
Podiatry school is very rigorous. It's tough, but it's super, super exciting. It goes by so fast. I can't believe that I'm almost done with it. For those of you who don't know the curriculum of podiatry school, the first 2 years are didactics, where you do your basic sciences. After those 2 years, you take your step 1 or part 1 board exam. After that, then you start your clinical rotations. Most of the schools do it the same way. My school did, our 3rd year being the clinical rotations, which entailed rotations in podiatric medicine, podiatric surgery, plastics or general surgery, interventional radiology, emergency medicine, and orthotics. And then our 4th year is where we do clerkships, and these are outside rotations with actually residency programs. So these are one month long residency program interviews almost, where you're just learning about podiatry and surgery.
Great. So Sriya, you just mentioned how the first few years are much more didactic oriented and the last year and a half or 2 years are more in-person clinical interactions. Can you talk a little bit about the workload, maybe either for those 2 groups, like didactic versus clinical, or maybe even split it up by the 4 years and talk a little bit more about the workload and maybe the similarities or differences?
Sure. I would say the workload is definitely a lot all 4 years, but the way it balances out changes a bit. Your first 2 years, you're doing your didactics, and it is like a full-time job. Whether you're in class all day, you come home, and then you're studying. Of course, there is time for you to volunteer, be in student-run activities and such. I don't want to scare you away, but it's all about how you balance your time. When it comes to clinical years, you do still have some classes on the side. So our school had classes Mondays and Tuesdays, and then clinic Wednesday to Friday. Your time is well spent, and even though it's very busy hours during clinics, you're learning so much and you're actually out there doing the real thing. So it makes you very excited to be there.
Great. It sounds like there's a natural transition from the first few years into getting out and being more hands-on and clinical. That's great. Now, when you first started podiatry school and you are doing all of this didactic work in the first few years, did you expect it to be like it was for you? And can you compare the first year to what it was like for you at your undergrad?
I definitely expected it to be very difficult. Me speaking from my own personal experience, I thought my first year was very hard, and it's all about a learning curve. So I definitely it took some time trying to get into the zone of podiatry school and all its rigor, but as it goes, it just gets easier because you start training yourself into how to study and be a better student. When comparing it to undergrad, I went to University of Pittsburgh, where the science classes are very rigorous as well. I will say in the first year, maybe classes like physiology were very similar to the classes that you take in undergrad. So it's definitely a very good way to transition from undergrad to podiatry school. If you're successful in your undergrad prerequisites, I think you would be very successful in podiatry school as well.
And Sriya, you just mentioned physiology as one of the courses. I'm imagining that some of our listeners are either taking courses or thinking about taking courses in the future that they may end up taking again in podiatry school, like biochemistry or physiology or anatomy. Do you have any comments or recommendations as to whether or not they should consider taking those in undergrad if they have the opportunity? Did you find that it was helpful that you had already seen some of that material?
I definitely think it is helpful. I believe biochemistry is still not a prerequisite for podiatry school. However, it might be now. I know when I was applying, it was a prereq for allopathic medical schools, but I had to take physiology and biochemistry as a biology major. I definitely think that it is helpful. Obviously, in podiatry school, they're going to tailor it a little bit more towards what we're doing as a profession. But it's a very good way to have a foundation. For example, I did not take anatomy in undergrad, whereas some of my classmates did, and they definitely had a little bit more of a foundation than me. And I think it's a very good way to just know what you're getting yourself into as well.
Wonderful. Sriya, can you tell us what's been the hardest part in all 4 years? What has been the hardest part of podiatric medical school for you?
I think the hardest part is just kind of like a juggling act. While there's classes, you also want to be involved with volunteering, you want to be involved with student run clubs and activities, go to conferences, just you want to do everything. You want to do research, you want to get your feet wet and everything. So I think the hardest part is just listening to yourself and knowing what you can handle. And I think as it goes, you just start to realize how to juggle everything. It's all a balancing act.
And what has been the most enjoyable or interesting part of your education up until this point?
I think every year of podiatry school has something exciting, something new. My favorite and most enjoyable part of podiatry school was fourth year clerkships or externships. This is when we're going around the country, or if you choose to stay in a particular state that has a lot of programs, you won't be traveling as much. But this time is a real test of your knowledge. And at the same time, it's when you're at the peak of your learning. I'm sure my classmates would attest to this when I say during this part of your education, we all feel like sponges. You're just learning everything. It was also very cool to see how podiatry varies in practice from place to place, and you get to kind of pick and choose what you like and what you want to see yourself in the future.
Great. You've highlighted so many things that you've enjoyed or why you came into this profession, but is there something that you would highlight to students who are considering podiatry as a profession but haven't made their decision yet?
As cheesy as it sounds, I want to say just do it. You don't have to take the leap of faith. Just trust me, it's worth it. But seriously speaking, I think the only way to really know if podiatry is for you is to shadow. And it's never too late to shadow, whether you're in high school, undergrad, in grad school, trying to change careers. Just make sure you shadow, because that's the real way of seeing if you can really see yourself in this profession.
Now, our last question prepared that we have before we move on to Q&A time is, what advice would you give an incoming first-year podiatric medical student that you wish you had received before you started school?
I guess I would say don't stress out about the little things. Just take your time to enjoy and learn. And one of the biggest things that stuck out to me now, being done with the process, is it all works out for the best. So just stay in the moment, just keep learning.
That's such good advice. Thank you, Sriya. Those are all the prepared questions that we have. We have lots of time for Q&A from the audience, so I'll take this opportunity to turn it back over to Tiffany, our Career Development Manager at APMA, and see what we have for questions.
Awesome. Thank you, Dr. Tower. And just to remind everyone again, if you have questions for Dr. Tower or for Sriya, you can go ahead and submit them in the question box that's down at the bottom of your control panel on GoToWebinar. So the first question that we have is for Sriya. Sriya, what did your MCAT studying schedule look like?
Okay, so since I would say I'm a non-traditional applicant, after I finished undergrad, I actually worked at APMA for a year. So my MCAT studying kind of went from the old MCAT to the new MCAT. So I did take both of them, unfortunately. So I think you have to know yourself when it comes to MCAT studying. I think what I fell into was doing everything possible, trying to get my hands on every type of coursework, every type of textbook, everything out there. Just know what your weaknesses are and try to hone in on that when it comes to doing practice exams. In addition, if you were to choose a more standardized structure of study, try to choose maybe one course. For example, there's Princeton Review, there's Kaplan. Just choose one. Try not to do all of them.
I'm overwhelmed just thinking about trying to do all of them. My gosh, that's great advice. Second question, again for Sriya. So what recommendations do you have for incoming first-year podiatry students?
Enjoy the summer before it, because next summer is not going to be the same. But real advice, I would say, if you have free time, shadow. It'll get you excited for the beginning. I don't think you need to go crazy and read all the books there are. Just have an open mind and be ready to study every day.
So Sriya, what things did you have to focus on during your undergrad to help prepare for podiatry school? And I know you sort of touched on this already in discussing some of the requirements, but was there anything additional that you did to help sort of supplement in preps for podiatry school?
In preparation for podiatry school, I would just say make sure you're focusing on those core subjects and your prerequisites. They definitely give you a good foundation. If you are a science major, I think the other courses that you have to take for your major really help supplement other subjects, for example, genetics, microbiology, pathology, etc. If you're not a science major, I wouldn't say you should worry about that, but if you do have time in your schedule, you can always take some more classes.
Good feedback. How did you choose the location of your rotations? And then additionally, how did you choose your choice of residency?
Okay, so choosing rotations is extremely confusing and difficult. I feel like we choose our rotations so early on before we really hear about different programs. So you just need to think about it for yourself, what you want for your career and your personal life. Do you want to stay close to home? Is there a specific region that you want to do your residency at? Or are you open to every place and you want to just go by word of mouth and try a bunch of different programs? For me, I definitely wanted to come back to the Northeast, so that helped me filter out my programs, and I only chose places in the DC metro area, Pennsylvania, New Jersey, and New York. I did one in California to see how it would be like, but it just really is up to you, and I think geographically speaking would be the easiest way to filter it down. And then the second part, I believe, was how did I choose my program? This was also very hard, but also came very naturally. Once you're doing your externships, as you go through the months, you kind of feel like you know where you fit in. And I think the biggest part of choosing a program is fit. You want to know that that place is somewhere that you can learn, a good environment, somewhere that you feel like you can fit in. As cheesy as it sounds, that's going to help you become a better podiatrist in the future, somewhere that really helps you learn more. Every program is great out there, and every program is going to get you to the final product. So it's really about where you feel like you fit in.
Love that. That makes a lot of sense. Is there anything that you did to prepare for your rotations during your third and fourth years, or did you just jump right in after your didactic years?
I'm sure that a lot of the students have been using the same materials other than classes and what you're learning in clinic. There's a lot of different like clerkship booklets and different things out there. So I definitely use those. Some of the big ones that everyone uses is Prism, Prism Plus, Crozier. There's a few more booklets out there. If anybody ever needs a copy, you can always reach out to me, and I'm happy to share everything I have.
That's helpful. Can you share a little bit? I know you've touched on it and you touched about sort of determining an appropriate residency program that you think is a good fit for you. Can you share a little insight on the residency match program itself and sort of the process for that?
The process of applying or the rank process?
Yeah, the process of sort of securing a residency and interviews and all that fun stuff.
Okay. So basically you do your clerkships. I believe an average is about 5 to 7 clerkships that you do. It really depends what school you went to. I did 6 clerkships. After you finish your clerkships, while you're doing your clerkships, you apply in around October. You can apply to up to 18 in your application packet, 18 programs. You can pay more to apply to more programs. Once you apply, you get back in December a list of programs that have offered you interviews. And then there's a process of scheduling your interviews and making sure everything fits. So we have interviews that are centralized in Texas. So it's about 4 days where you have interviews all day or spread out, just depends how you schedule it. And then you make your rank list. So when you make your rank list, just be true to yourself. Everyone gets in their head trying to think about what the programs are thinking, who likes you most and everything. One of the best advice I got from upperclassmen were make your rank list based on what you want. Don't overanalyze it. So once you make your rank list, you submit yours and programs submit their rank list, and you have a match in March.
Awesome. Yeah, there's a lot going on with finding a
If there's
residency.
anything specific that you want to know about that process, I can go into detail with something.
No, I think
Tiffany,
that's awesome. Yes,
can I
Diane.
ask a follow-up question of Sriya? Sriya, match was just last month. What was that like?
Well, it was very different for us and kind of sad since we didn't get to have our match reveal party and everyone be together. The one great thing about podiatry school is we all kind of become like best friends, all there for each other, and we wanted to celebrate together. But at the same time, it was still super exciting. We all find out at like noon at the same time. So we just log into our application site and you kind of just see where you're going, and it's super exciting.
So, Shreya, were you ever unsure about the surgical aspect of podiatry, and has your view changed?
Definitely was unsure at some points. Not that I didn't want surgery in podiatry, but more so like, oh my God, can I do this? You're always going to feel that way, especially as a student, because it's a big change. But you just have to trust yourself, trust that you're going to get good training, and it's all going to work out. And at the same time, you don't have to do surgery. You do have to do your residency, which is surgical residency, but the great thing about podiatry is you can practice how you want. If you want to specialize more into wound care or anything else, you can choose to do that.
Awesome. So now I'm going to open this question up to both Dr. Tower as well as Sriya. Do either of you or both of you have any advice for non-traditional applicants who maybe have been out of school for a while? And what about applicants who have backgrounds in medicine, but not necessarily podiatry?
Should I go first, or?
Yeah, go for it, Sriya.
Okay. I say I would keep my advice the same way, even for non-traditional applicants. Just make sure you shadow podiatrists and podiatry, because you really want to make sure you know what you're getting into. One thing I would like to add with that is make sure you shadow in different environments. Some podiatrists work only in the hospital, some work in multi-specialty practices, some private practices. So you really want to get a good idea of what the whole profession is about. So make sure you shadow at least 2 or 3. I think that would give you a better idea.
And I'll just add on that if and when you decide that podiatry is the career for you and you end up in podiatry school, to really think about what used to work for you in terms of studying and study habits, and maybe things may or may not have changed in that regard as you have gone through and maybe done other work or other education since studying so much in undergrad, and just realizing that the first little bit of podiatry school, there may be some challenges just as you figure out your organizational strategy and study habits and things along those lines if you end up going to school.
All right, Diane, excuse me, Dr. Tower. While I have you, I have another question. This one may be a little bit more geared to you. And I just lost it. Bear with me. You guys are sending in these questions super fast, which is awesome. We love receiving them, so keep them coming. All right, so what have you been able to do with your DPM degree and an MPH degree career-wise? And did you get your degrees simultaneously or separately?
Those are very good questions. I did my DPM degree at Scholl College in Illinois, and it was during my second and third years that I did a part-time online master's degree program. That's the MS after my name, and that's a healthcare administration and management degree. So I did do some higher education concurrently when I did my DPM degree. I went on and did my residency training in Colorado. And after I graduated from my 3-year residency program, I did a 1-year public health fellowship where I was not practicing for that year. I went back to school full-time at the Dartmouth Institute in New Hampshire and received my MPH, my Master's of Public Health degree from Dartmouth College for that year after residency. And then since then, what I've been doing is I've taught at one of the podiatry schools while practicing in a local area in Illinois. And I practiced in New Hampshire for a number of years. I was doing surgery, seeing patients in clinic, treating patients in the hospital, doing a number of things that you can imagine, from having a small practice, being in a wound care center, working in the hospital, doing surgeries, and working on getting board certification. And then when I finished some of those accomplishments, I moved on and am doing full-time administrative work for the association. So I work full-time for the American Podiatric Medical Association, where I get to use all of my degrees to help our profession and all of the podiatrists across the country do the things that they do best, and that's take care of patients.
Were there any research opportunities available for you while you were in podiatry school? And if so, what research did you do?
So there are definitely lots of research opportunities, and I think one of the biggest things to know about these research opportunities is you have to kind of be your advocate when it comes to research. So for me, I did a little bit of research outside of podiatry school. I did a few months at University of Miami's medical school in the Department of Dermatology. So I did a bit of research with their wound care center. In addition, during my clinical years, my end of third year and fourth year, I was in the podiatry clinic and we saw a very cool case of an epidermal inclusion cyst. So me and two of my professors, we worked to do a little bit of a case study type of research on that. So there are opportunities, it's just how you approach it.
Awesome. Dr. Tower, do you have anything to add?
I would echo Sriya's comment about being your own advocate. At the school that I went to, Scholl College in Illinois, there was a summer program after your first year of school that you could stay in the area and do research over the summer, a summer research program of sorts. And so I stayed and did that, which offered some opportunities to do some poster and oral presentations as a student, which is really great experience. And then that interest in research just grew for me over time, doing some research in residency, moving on to the formal MPH training, doing a number of different types of studies, cost effectiveness analyses, systematic reviews, case studies. There are lots of different ways to get involved, but Shriya's got it right there. Be your own advocate. If it's something you're interested in, find a mentor that's willing to share with you, have you get involved in projects that they have going on. There's so many things that are going on when you're in podiatry school or in residency. It's easy for something like that to fall by the wayside, but if you're truly interested, find somebody to work with you and mentor you and be there to support you in something that's of interest.
That's helpful. Thank you. All right, so this is kind of a loaded question here a little bit. It's got a couple different caveats, so I'm gonna try to piece it out in the most organized fashion. And both of you, again, feel free to address this one as well. So we talk a lot about the subspecialties within podiatry and all that it sort of encompasses. How do these subspecialties compare to MDs and DOs? And how do you feel that impacts job opportunities on the other side of residency or fellowship? I told you it was heavy. It was a lot.
Well, Sriya, I'll take this one to start, since
Okay.
I've been on the other side of residency for a little while now. But you know, it is a challenging question to answer because I can only answer from the podiatrist perspective. You know, I worked in an orthopedic department in a very large academic center where I was the only podiatrist working with orthopedists and working very closely and collaboratively with other professionals, as Sriya mentioned before, like endocrinologists, dietitians, primary care providers. So I'll speak from our perspective, podiatrist perspective specifically, in that we are very well-rounded in terms of our training and education. So it's not that we're taking care of one particular component of the foot, ankle, or lower leg. You are treating the whole patient, and they have a condition or an ailment of their foot, ankle, or lower leg. And so it's really you know, understanding the entire patient so that you can care for whatever is bothering them. And I'm not saying that the other professionals don't think of it that way for themselves, but at least from my perspective, it's a great opportunity to really learn and focus in on something so early on in your career, whereas you know, other professionals may be doing much more general medical training and then having to specialize or focus in a little bit later in their career. It may take them a little bit longer period of time to get to the point where we feel like we are early on in our careers, you know, because we are focusing on so early as even first year of podiatric medical school, where you take a separate special course on lower extremity anatomy. So after you've taken your anatomy course, just like other MD and DO students, you take another anatomy class after that that just goes in so much detail of the lower extremity itself. So, you know, we talk about the subspecialties of podiatry, whether that's wound care or sports medicine or limb salvage or trauma or surgery or any of the number of things you can think of. All of those are subspecialties, but you likely know plenty about all of the other subspecialties that are part of podiatry.
And I'm just gonna agree with Dr. Tower, but one of the things that reminded me of was I think one of my first lectures of podiatry school during orientation, our professor told us, and it always stuck with me after he said this, he said, you guys aren't going to be foot doctors, you're going to be physicians who specialize in the foot. So I think that really makes me think about what podiatry is. Yeah, there's subspecialties, but it all comes down to the foot, and obviously the foot and ankle are connected to the rest of the body.
That's a very good point. And for all of our participants here, you guys may recognize Sriya. She is featured in the recruitment video that is shared on our Step Into Podiatry website. And she articulated that exact point that she just made beautifully in that video. And thank you for reiterating it. That's a very good point to make. So Sriya, my question for you now is, how do you feel your first 2 years of podiatric medical school prepared you for clerkships and rotations? And did you find it an easy transition to apply your coursework to real cases?
I think it definitely was an easy process and a good transition. When I was in my first and second years of podiatric medical school, I definitely did have my doubts. I was like, how is this all going to translate into the bigger clinical picture? And you just have to almost trust the process. Once you get to your third year clinics, you start to actually see and observe cases and pathologies on patients. And then you kind of have that aha moment where, oh, wait, I did learn this in neuro class. I did learn this in derm class. So it's just all about making those connections. You don't really see it until it happens, but all I can say is it does.
Good points. So I love this question, and I think I already know the answer, but I'm going to let both of you take a crack at this one and give your advice here. But is it too late to start podiatric medical school at 30?
No, it definitely is not. It's definitely not. I think anyone at any point in their life can start podiatry school. It doesn't matter if you're a young adult, if you have a family, if you have kids, there's never a wrong time to start podiatry school. And I think one thing to remember is that you always have your teachers who are there for you, and your classmates and friends do become a really big support system.
Yeah, I agree. It's definitely not too late. There was a few classmates of mine, but one in particular was, I would say, mid to late 30s. And again, I mean, the faculty at the colleges, your classmates, those are people that, you know, you're all in it together. In the end, you may be competing for residencies and things of that nature, but in the end, you're all going to be colleagues. You all are colleagues from the day you set foot, that first day of school, and everybody is there to support one another.
Again, I'll open this one up to both of you. Where do you see podiatry in 5 to 10 years?
Should I?
You want to take that one first?
Sure. So one of the things I love about podiatry that I didn't bring up is it's such a small profession, and in a sense that there's such a strong sense of community. But at the same time, I have been seeing just in my short 4 years, I'm sure Dr. Tower has so much more to add to this, that podiatry is really growing. Even from, I think, my first year of podiatry school, when the VA Act got passed, that was a huge success for us. And I think it really is just up to every generation, every graduating class to grow podiatry into something bigger and actually showcase what it really is. There's still a lot of people who don't know how much we can do as a podiatrist, and I think it's up to us to help it grow. And I totally see it becoming something even bigger than it already is in 5 years.
And I look forward to having Sriya and all of her colleagues from her graduating class and all of the classes to come, you know, working with us as we move forward, not only with regulatory advocacy, but legislative advocacy. In the next 5 to 10 years, it would be phenomenal to be recognized as physicians under every governmental program, and to be recognized as the physician of the foot and ankle, as Sriya said. We have our education, training, and experience that is absolutely in line and comparable to others who do things like we do. So, I look forward to the next 5 to 10 years and seeing all of that unfold, especially with the help of, again, people who in the younger generation who are being trained so phenomenally well, and having those people on the front lines with us as we, some states we're doing some scope of practice adjustments so that people like Sriya, who's trained to do so much in residency, can go to any state and treat patients exactly the same way. So, I can't wait to see what the future holds for that.
And sort of hinging off that response, we've gotten a couple questions of, given everything that's going on right now with COVID-19 and the ongoing pandemic, what roles are DPMs playing in the front lines, and sort of how does the role of podiatrist come into play with COVID-19?
Yeah, I can start with that one. We're hearing, since I work for the association, we hear a lot of questions from our members who are podiatrists across the country. There are podiatrists who are still very much active in seeing patients because they have urgent or emergent conditions, whether that's a patient who has diabetes experiencing an ulceration or an infection that needs care in order to save their limb or save their life. We have providers who are treating trauma patients, people who are experiencing traumatic ankle or foot or leg injuries at this time. So we have podiatrists who are doing some of their normal activities right now amidst the COVID-19 crisis. And then there are others who, whether they're in practice, whether they're doing research, whether they're residents in training, we have folks that are helping with clinical trials right now that are looking at some of the medications that might be used to treat the coronavirus. There are providers being asked to come and help do testing at testing centers. We have podiatrists who are actually, some of them are in residency training right now, and because of their education, training, and experience, especially in residency, when you might be doing a rotation as a critical care provider, you're functioning just like a critical care resident would. You're working on their team just as an MD or a DO resident would be, and those residents are treating patients on ventilators and helping in any way they can on the front lines. And so I think, that's just a testament to our education and training that we go through, that we are fully capable of providing the same services, the same quality of care to patients in need, regardless of the situation.
I'm not going to add to this one because I think Dr. Tower did a really good job explaining it. From what I've heard about residency programs, definitely you in residency, especially your first year, you're rotating from internal medicine and critical care. So you're definitely being in the front lines for COVID-19. At the same time, unique aspects of podiatry, like Dr. Tower was saying, was diabetic wound care, and these patients do need to be seen weekly. So that's still, in my opinion, an essential activity for healthcare.
Awesome. Good responses. I'm going to open up this one to Sriya. It's kind of twofold. You're getting ready to start your first year residency. So what are you most nervous about, and what are you most looking forward to?
I think I'm nervous about a lot of things, but I'm also very excited about those same things. One of the things I'm most nervous about is, as a first year resident, you rotate on the floors. So you're in charge of all the inpatients, essentially. and something that I'm kind of nervous about because it's a lot of responsibility and a huge transition from going from a fourth year medical student, seeing it as an observer during my clerkships. I was watching the first year residents do that very thing, and now it's going to be me. So I think the sheer change of responsibility is something I'm nervous about. But I'm also excited because I was told during floors that's the time that you're learning an incredible amount and you're learning so much so quickly. So I think there's something to be nervous about, but also very exciting.
Awesome. This is one that you guys can both answer. Dr. Tower, you certainly can speak to this one. What is just the average day in the life of a podiatrist like?
Sriya, I can start this one. I can give you an example of what a day in the life was like for me when I was in practice, because these days, I'm full administrative time, so it's much less exciting in terms of patient care. I don't currently see patients, but I can remember back to not so long ago when I was in practice. Again, I was in New Hampshire. It was a large academic medical center. And there we had educational rounds every morning. So every morning at 6:30, we had a 30-minute meeting, and then we'd get off to seeing patients, whether it was on the floor for a few minutes before clinic started at 7:30. And for me, a few days a week, that was either in the Comprehensive Wound Healing Center, where we had a significant wound care population and diabetic patients who were at risk of wound complications or pedal complications, or it was in more of a general foot and ankle clinic where we would see deformities or people with foot pain or heel pain. And so it was one of those two types of clinics, followed by an afternoon. Usually after afternoon clinic, it would be finishing rounds on the inpatient side and or doing add-on cases in the main operating room, which could be incision and drainage or amputation, something that some kind of surgical procedure that an inpatient might require, and then finishing any rounds or any paperwork documentation before heading out. And then a few times a week, maybe having some elective surgeries like bunions or neuromas, hammer toes, ankle scopes, those types of procedures at a nearby surgery center.
I think going off of what Dr. Tower said, I just want to add that a typical day for podiatry is exactly why I like podiatry. It's not so typical. Every day is different. Even though you have some kind of structured schedule, you can be bouncing in and out of different environments and different clinics, and it keeps it very exciting.
All right, so Sriya, compared to that, can you describe just your typical day as a podiatry student?
Yeah, so typical days, honestly, the structure, it's pretty much the same your first 2 years. It's just classes, probably like 8 to 12. You have your lunch break, and in the afternoon, you might have more classes or split into labs. There's a radiology lab, anatomy lab, physiology lab, biomechanics lab. So that's your first and second year. Your third year, it just depends what school you went to. My experience was Mondays and Tuesdays were classes, and Wednesday, Thursday, Friday was clinic, and we rotated through different podiatry clinics or internal medicine, ER, interventional radiology, and a few more. Fourth year, a typical day is basically just shadowing residents and seeing what their residency program really is like. And if you have classes in your spring semester, ours went Mondays and Tuesdays was clinic, and Wednesday, Thursday, Friday was seminars.
Awesome, thanks. Sriya, how do you feel regarding student debt? Like, do you feel overwhelmed by your student loans right now, or do you feel like you're pretty much investing in yourself and you're going to be well prepared to pay them off in the future? Like, how does that, a few folks have indicated they're concerned about that. So how do you sort of reconcile that?
Kind of funny you bring it up today because I just logged into my FAFSA account yesterday and saw the big number and was definitely very overwhelmed by it. But as a student, we have a podiatry management seminar, so we're kind of learning different tactics of investments and how to pay off student loans in that class. There's a few podcasts and books that I like to listen to, and seeing how the profession really is and the growth of it and where I'm going to be in a couple of years. I think it's all going to work out for the best.
Love that. We think it will too. We have about 10 minutes left, so I'm going to try to crank through. You guys have so many questions and they're awesome, so keep them coming for sure. We're not even going to get to all of them, but thank you for sticking with us. What is the environment like in podiatry school? Do you feel like it's pretty cutthroat? Are you friends with everybody? What's it like?
I actually don't think it's as cutthroat as some of my friends in other medical specialties or medical schools say it's like. And I think that might just be because podiatry schools are at a much smaller scale. For example, my class is about 50 students, so we're all together all the time. Obviously, there's some healthy competition, and it's always good to have a little bit of competition, but I don't really think it's cutthroat and everyone's helping out each other. Other people might see it differently, but I think it's always been good.
Dr. Tower, someone would like to know what your typical day in the life of a podiatrist is in your current profession. And when you initially kind of started out, how did you find time to achieve work-life balance?
Yeah, that's a very good question. So I will say that I have always been interested in the public health side of things and more on the prevention and the community health, that sort of perspective of population health. So that's what started me down the road of my master's degrees. And in school, I did the healthcare administration and management to get a better idea of just the healthcare delivery system in general. And then after my residency training, decided I wanted a little bit more formal education and training in research methodology. And so that's when I went down the MPH route. And so I always knew that I wanted to do something administratively in the profession, but I didn't know I was going to end up where I am so early in my career. I practiced for about 4.5 years before making the change from clinical practice to full-time administration. And I had some personal goals that I wanted to reach, those being board certifications. And once I was board certified in the 2 boards that are recognized in the field, I decided it was time for me to make a change and be able to do a little bit more with my master's degree that I wasn't able to spend so much time doing when I was full-time clinical practice, just because it was a busy practice where I was the only podiatrist in a large system, and it just was not conducive to doing some of the things that I was really interested in, which is research and looking at data. And so after I finished doing my clinical work, I transitioned to full-time administration with the association. And now a typical day for me is doing a lot of communication and education of our members. And again, our members are podiatrists who practice all over the country in many different settings. So that could be a solo practitioner in a private practice, a small group of podiatrists working together in an office, a multi-specialty group that has many other types of providers, but podiatrists are part of those groups. It could be somebody in an academic setting like I was. And so we have members who vary in terms of their needs from the association perspective, and I help in a number of ways try to meet those needs with my colleagues at the association. And so one of the main things that I work on is our data registry, and we are in the process of developing a very large data warehouse. So we can have data to do research, whether that's the cost effectiveness of podiatrists in the healthcare delivery system, or seeing what the outcomes are of podiatrists doing different types of surgical procedures or wound care, just anything that would help demonstrate the value podiatrists offer to the healthcare system. I also help in a lot of the education components of our association. So any educational meetings, I might be helping select topics that we would like speakers to speak on at any of those meetings. And then with Tiffany on the call today, we also work a lot with our young physicians, and those are podiatrists who are within the first 10 years after graduating from school. We realize that they have special needs that the other members of our profession may not need, like discussing student debt and how do I start a practice, or how do I negotiate a contract for my first job? And so we have special programs that support that particular cohort of our membership. And so on a daily basis, I work a lot with my colleagues in a number of departments, from our regulatory attorney side to Tiffany working with young physicians to our educational components, as well as any of our members. So that's what a day is like for me now.
So you're not busy is what I'm hearing. You don't have a lot going on. We're going to end. This is going to be our last question. So I'll open it up to both of you or one of you. What would you just say to someone who is trying to choose between pursuing a career in podiatry versus pursuing a career as an orthopedist? Pros and cons? Thoughts?
I think I've said this a million times already, but one of the biggest things is shadowing. You want to shadow both like an orthopedic surgeon and a podiatrist. I also remember what I said about podiatry having so many different specialties within it. It is a surgical specialty, but there's also so many different aspects to podiatric medicine and surgery. The other thing that I always like about podiatry school is that your specialty is concrete from the very beginning. You already know where you're matching into. I mean, you don't know which program, but you know what specialty. So with podiatry, it's essentially guaranteed surgical specialty.
Well done. Thank you, Dr. Tower. Any final words?
I think that's a great point, Sriya. Again, I mean, I can't speak from the MD or DO world, but I mean, those getting into a surgical specialty, from my understanding, it can sometimes be a challenge. And, you know, with the shortage and talks of shortages in primary care and internal medicine and things of that nature, you know, that may end up being a route that so many people go. But if you know you want to do something with your hands, do surgery, things like that, this really is a great way to know exactly what you're going to be doing when you graduate from school and from your residency.
And guys, I know that we have unfortunately had to sort of suspend our current DPM Mentors Network because of COVID-19 right now. And it obviously, you can't shadow when you're supposed to practice social distancing. So among a whole other thing. So please know we're working really hard behind the scenes to try to come up with some alternative, one of them being this, to kind of give you guys an outlet to kind of ask some of these questions of current students and current practicing physicians. So please stay tuned, and thank you for being patient with us as we try to continue to give you this experience as best as we can. In closing, I thank you all so much. You guys have asked some really great questions. You took the time to join us today, and we're really grateful for that. A special thank you to Sriya for sharing her podiatry school experience with everyone.
Thank you for having me.
Thank you to Dr. Tower for sharing her insight and her experience with the profession as well.
Thank you.
I hope all of you will join us for our second Step into Podiatry webinar, which is being held in 2 weeks on April 23rd. During that webinar, we will host a Q&A about the requirements and application process for Podiatric Medical College, and we will have guests joining us from the American Association of Colleges of Podiatric Medicine, which is the organization that administers the centralized application system for the colleges. Registration is available online now at stepintopodiatry.com/resources. In addition, AACPM is also hosting a virtual podiatric medicine career fair on April 24th. during which you'll be able to chat directly with admissions representatives from the 9 colleges of podiatric medicine. That registration is also available at stepintopodiatry.com/resources. Thank you again to everyone who joined us today. I hope everyone stays safe and healthy, and we look forward to talking with all of you on the 23rd. Take care.
Bye, thanks.
Thank you.